Tēnā koutou katoa, nau mai haere mai ki tēnei mate puna Aotearoa webinar series on pain. Ko Tracy tōku ingoa he kaitohu tohu hauora turihono ahau. Welcome everyone to Arthritis New Zealand webinar series on pain. My name is Tracy and I'm the online health advisor for Arthritis New Zealand. Tonight's webinar is financially supported by Pfizer, so we can bring this to you free of charge. But other than the financial support, Pfizer does not have any further input, and we are grateful to our sponsor. I'd like to introduce you to our speaker tonight, Dr. Jacqui Clark. Jacqui hails from the beautiful Te Moana Atoi, or Bay of Plenty, where she runs her clinic, Pains and Brains. Jacqui holds a PhD, is a registered specialist pain physiotherapist, lecturer, and postdoctoral researcher. She is also a member of the Pain and Motion International Research Collaboration. She is an international postgraduate teacher and lecturer in the subject of persistent pain, anxiety, and altered sensory motor function, and is a regular contributor on peer review panels for various academic journals. Jacqui initiated and now chairs the Physiotherapy Pain Special Interest Group in New Zealand. We are so lucky, very grateful and humbled to have her here tonight to speak about her passions and her expertise in pain, with a focus on nociplastic pain and fibromyalgia. So without further ado, I'll hand you all over to Jacqui. Thanks, Jacqui.
Thank you, Tracy, and thank you so much for inviting me. All right, so I want to talk to you about what's now called nociplastic pain, which is the new word for persistent central sensitization, and a little bit more on top of that. So I'll explain what that is, how it applies to fibromyalgia, and we'll talk about how fibromyalgia and indeed nociplastic pain is diagnosed. And some of you may have been through this process or may not be familiar with it, so it might be new. And also factors that are involved in why some people develop fibromyalgia and nociplastic pain. And then we'll have a look at some of the ways that we can address it through rehab and self-help mechanisms. So I haven't got a lot of time, so I'm going to get through a lot of material as we go along. So hopefully I'll get there on time. Okay, so nociplastic pain is defined by the International Association for the Study of Pain, or IASP for short, that pain that arises despite no clear evidence of actual tissue damage or threatened tissue damage, and no evidence of disease or lesion. And that can be really frustrating for people because you go around different clinicians and you try and find your diagnosis, you get a scan and it doesn't show anything. And it can be very, very frustrating having all this pain and yet no clear tissue damage to show for it. So of course, people then start to feel that they're being told it's all in their head, which is an appalling thing to be told, that your pain is all in your head. Pain is very real, it's a real experience, and we now know that it's due to neurophysiological changes within the central nervous system, which means a little bit of low-grade inflammation can develop within the brain and spinal cord as part of an immune response to perceived threats and other factors. Threats can be things like viruses, it can be perceived threats and all sorts of things, which I'll expand on later on. So it's a real neurophysiological phenomenon that causes the pain, and it arises from the brain and spinal cord functions rather than damaged tissues if it's predominantly nociplastic pain. So the way to recognize whether or not you have nociplastic pain, which is this ongoing chronic persistent pain without tissue damage, is that it's not mechanical. If you sprain an ankle, you know that if you tip the ankle to the side, it will strain that ligament, it'll hurt. And if you take the ankle back into another position away from that strain position, it doesn't hurt. So that's called mechanical pain. You stress it, it hurts, you de-stress it, it doesn't hurt. Whereas people with nociplastic pain, and some of you will experience this, will recognize that the pain tends to move around. So it's on the shoulder one day, it's in the hip the next, it's in the lower leg one day, and up in the headache area another day. So it moves around. It can be all down one side of the body and not so much the other in some cases. Or it can be mostly the top half of the body and not the bottom half in some cases. With fibromyalgia, it tends to be top, bottom, right and left in multiple regions. And also with nociplastic pain, you get what they call allodynia, which is a hypersensitivity. So, for example, if you stroke the skin with the cotton wool, it can be really tingly and really irritating. Or if you poke yourself with a pen or something, which would be a bit uncomfortable normally, but with hyperalgesia, it's very, very uncomfortable, like painful to do things like that. So allodynia and hyperalgesia are a heightened response to normal or slightly painful stimuli with lots of discomfort and pain. And that's a real phenomenon, and it's a known part of nociplastic pain, and we use that in our diagnosis. So when I diagnose nociplastic pain, I'll stroke the skin with cotton wool, see what the response is, tap the skin with a cotton bud and see what the response is. Does the pain amplify as you keep tapping? When you've finished tapping, does the pain then linger for a bit longer? That's called hyperpathia. And these are all things that people with nociplastic pain, which fibromyalgia is predominantly a nociplastic pain condition, will experience. And so to have that tested and recognized can be very empowering when you realize that this is a real phenomenon. It relates to actual physiological changes. So the reason that the sensitivity is there is because of nociplastic pain mechanisms. So other things that come with it are light sensitivity, sound sensitivity, sensitivity to being to pressure. So you might be sitting on a seat for too long and start feeling really uncomfortable where the pressure is from the seat. Sleep disturbance and fatigue, those are also factors that relate to nociplastic change. And cognitive problems, so brain fog, which some of you will be familiar with. So if these are all present, then the diagnosis is likely to be a predominant nociplastic pain presentation. So fibromyalgia then is part of nociplastic pain definition, and it's chronic, which means more than 3 months worth. Chronic actually is a word that people use sometimes to mean it's really bad. Oh, it's chronic, meaning it's really bad. The actual term chronic means you've had it for 3 months or more. That's the proper term for chronic, 3 months or more. So chronic, or now persistent, we use the word persistent because it's been a bit, chronic has been a bit misused. So you'll also see persistent pain in the literature. In 4 or 5 body regions, so trunk and or both arms and legs. And it's often associated with anxiety, which is quite common, and depression. People's moods can swing up and down, which is part of the central nervous system struggling with all the neuroinflammation and associated changes within the brain and spinal cord. It's often made worse with the female hormones, so pre-period in females, it'll often be worse. And of course, around perimenopause, you start to get lots of changes as the estrogen levels also influence fibromyalgia. So it comes with these other problems as well, and functional difficulties, particularly sleep function, waking unrefreshed in the mornings, brain fog, can't think clearly. Those are all part of the fibromyalgia, and it's multifactorial. So there's the changes within the central nervous system, but it's influenced also by stress and anxiety, depression, lack of support, and it's influenced by negative beliefs, or what we call catastrophizing, which is where you're thinking, if this doesn't come right, then that's going to influence this. And then if that can't happen, well, that's going to mean that person's going to be affected. And you end up going down and down the track of worry, really, more and more worry. That's called catastrophizing. And that makes your whole system more wired for threat and for worry, which makes the immune system even more sensitive to fight that threat. So just to give you an overview of what fibromyalgia involves, which again, a lot of you will recognize, as part of the nociplastic pain system in fibromyalgia, you'll often get a sensitive bladder where you feel like you need to go to the loo, but when you go, there's not much there, but it felt really full, the bladder. So bladder sensitivity makes you want to go more often. Bowel sensitivity. So a lot of people have difficulty tolerating certain food groups, and people with fibromyalgia actually have a different microbiome in the gut compared with people without fibromyalgia. So there's a lot of research developing now on what best nutrition perhaps can help with fibromyalgia. And that's IBS, irritable bowel syndrome. So irritable bowel syndrome is an irritated or sensitive bowel, but without pathology. So it's not an actual inflammatory bowel disease that they can pick up on pathology, which again is a bit frustrating because you know there's something wrong with the bowel, but they can't find any pathology. It's because of heightened sensitivity of the bowel, so it responds to food groups which it shouldn't normally. Migraines are very common, and of course, irregular periods for ladies, but fatigue, mental fatigue is a biggie. So 80 to 90% of people with fibromyalgia in some research studies have shown, research studies have shown that 80 to 90% say that fatigue is the biggest problem more than pain. So difficulty with memory, brain fog, concentration, feeling stiffness in the muscles. So it's not that the muscles or joints are damaged. It's just that when you move them, they're so sensitive, the nerve ends fire off and it feels like you're pulling against stiff muscles. But actually, if you look at the length of the muscle, it's actually the same length. It's just it feels a lot stiffer. And I mentioned light, sound, smell, hypersensitivity. So you can smell something way before the next person can, or you have to ask people to drop the lights, or you might want to wear tinted lenses when you're out and about. That's all part of the sensitivity of the brain and spinal cord as part of nociplastic pain. And you may have noticed that those things do get worse when you're more anxious. So if you've got more stress on board, or you've got a lot of anxiety happening at that time, even if you're not sure what triggers it, sometimes you don't know what triggered anxiety. Your body just feels wired, and you get to bed and you're just too wired to sleep. And it's almost like it's nothing to do with psychology. It's been triggered into feeling wired physiologically. So I distinguish between psychological anxiety and physiological anxiety, where your body just feels absolutely wired, like you've had 12 coffees, but you haven't. That's all part of this central sensitization or nociplastic pain mechanism within the brain and spinal cord. Often there is a history of trauma as well, which can heighten anxiety, of course, and that heightens pain further. With a lot of stress, as I'll demonstrate a little bit later, you have difficulty controlling fight or flight and difficulty controlling postural hypertension. So when you stand up, you feel a little bit woozy, maybe even a little bit faint, and then you get going and you're okay. Difficulty with temperature regulation, hot, cold. Some people get Raynaud's as well, which is where the fingertips go white. So these are actually all part of the same thing, because it's often a bit scary when you get all these different things happening. You think, oh, I need to go and visit the optometrist about the eyes problem, the gynecologist about the stomach pains and the dysmenorrhea. You know, you start visiting different specialists for different conditions, but actually it's all part of a highly sensitized central nervous system. That's the brain and spinal cord. So you begin to kind of recognize, okay, right, it's the fibromyalgia we've got to get control of. It's the sensitivity of the nervous system we've got to work on bringing down. And then you feel a bit more in control. Waking unrefreshed is a big one as well in the mornings. Anyway, I've got to move on and remember to keep to time. So causative factors have been found. So there are lots of different mechanisms. Interestingly, the genetics is showing up a lot. The COMT gene, which is a very long word, which I won't bore you with, but the COMT gene, which you can Google, is related to sensory sensitivity. So it looks like, you know, a big proportion of the population are naturally highly sensitive. They reckon 15 to 20% are naturally highly sensitive. So these people are often empathetic people, creative people, can read the room emotionally before the next person can. So just by nature, more sensitive, often in creative arts or caring professions, that sort of thing. And the COMT gene is related to that sensory sensitivity. So if you already have sensitivity, then that system, your sensitive nervous system, which is a wonderful thing to have for those qualities, the downside is that you can become overwhelmed and overloaded with sensory overwhelm at times. Everything's too much. It sets off that sense of being wired and just overwhelmed. So that happens more easily if you're naturally highly sensitive. But don't forget, it comes with those skills, creativity, empathy, all those things. So it's not all bad. And microRNAs is another one. So these are the cells found in the blood that are part of the DNAs, and microDNAs are quite different in people with fibromyalgia, which is interesting. So epigenetic research is actually taking off with regard to discovering what causes fibro and therefore what can possibly be manipulated for treatment, which is promising. Other factors that we know are in the causative elements, so things that may create more risk for fibromyalgia, are big stresses, stressful life events, like a big trauma of some sort, particularly actually when it's occurred in childhood. The childhood trauma has been shown to be related to why people, or risk factors that why people develop fibromyalgia. And then we've got inflammatory mechanisms, which are receiving quite a lot of attention. When the brain, whereas your brain is your protector, and your brain has to work all the time to judge whether or not certain stimulations or certain environmental factors may be a threat to your system or not. And in its protection role, it will be alert for threat much of the time, which is part of what it does. And it keeps your system balanced. So if you're highly stressed, you'll go into a bit of fight or flight. But then you have your parasympathetic nervous system, which brings you back down into rest and digest. So the balance between those is always being maintained by the brain. So if you have a lot of stress going on, allostatic load, which is the next one down after inflammatory mechanisms, allostatic load is the stress load on the body, all the things it has to organize to keep the balance in your body. If that's increased all the time, inflammation goes up within the brain and spinal cord to prime the immune system to fight whatever threat it is that's in the environment, or it might be a virus. So viral infection can come into the body. That's a threat, of course, to the body, and it has to fight that virus. So it increases the neuroinflammation and the immune inflammation ready to fight it. And that makes you very sore. So you'll know that if you've had a virus on board, for the first couple of days, you're much more sore. Even if you haven't got fibromyalgia, someone without fibromyalgia will recognize what a virus does. It makes you achy and stiff and light sensitive. Well, that is the neuroinflammation and the immune inflammation that you have in nociplastic pain and in fibromyalgia, that kind of achy sensitivity. And a virus can trigger fibromyalgia. So it's a bit like, what's the Epstein-Barr virus, so chronic fatigue. Those are all related to viral infections that trigger ongoing problems in the immune system. So those are being studied, and there's a lot of interest related to COVID now, because there's a big overlap between COVID and the fibro symptoms and these viral infections that give ongoing sensitivity and fatigue and similar symptoms to fibromyalgia. So yeah, watch those spaces when it comes to being updated. Just a very quick brief mention of the research we did at Manchester and Brussels to show that people who had, you can measure nociplastic pain by using a questionnaire called the Central Sensitization Inventory. And if you score more than 40, then your brain and spinal cord is highly sensitive. So central is brain and spinal cord. Sensitization means it's all very sensitive. And the Central Sensitization Inventory can tell you how many symptoms you've got that are nociplastic pain symptoms. And we found that people with high levels of nociplastic pain symptoms were also naturally highly sensitive, but had passive responses to being overwhelmed. So if you're highly sensitive and you go into a big shopping mall or something that's, you're running a bit behind, the kids are at your ankles, you're in lots of lights, lots of people moving around, and just too much sensation going on. If you are sensitive and don't respond to that overload by either removing yourself from the shopping mall or putting sunnies on or putting your noise cancelling headphones on just to reduce that sensory overwhelm, you're going to get more and more sensitive and sore. And people with that passive response to being overwhelmed, as in not doing anything about it, were the ones that had the greater level of symptoms. Also, people who are naturally prone to anxiety. Some people are just naturally prone to become anxious in response to a potential threat. So if that's you, then you're more likely to have a sensitive nervous system. But interestingly, we also found that some people have low body feedback. So they actually feel quite numb in certain areas, or not completely numb, but a bit numb in certain areas. And that's called, these are just the names of profiles that we use to measure these. But low body feedback actually can be a problem after trauma. And even though it's not very sensitive to touch, it's still very painful. So that's another group of people that's quite interesting. I won't talk about that one because I need to move on a bit faster. So just to say as well that when you have a lot of stressors in your system, it depends how you cope as to whether your system becomes all sensitive, ready to fight threats, or whether you just box on. So if you've got good resilience, you don't let the anxiety and you don't let the stress get to your body too much, so you manage your pain better. Whereas if you're always in fight or flight, then your system is highly sensitive, ready to fight whatever threat it is. And so you become more sore, and that becomes more of a threat. So you get emotional stressors. So family, work, friends, those sorts of stresses, including, of course, emotional trauma. Nutritional stressors, so certain food groups, like the nightshade food group, that's your tomatoes, peppers, chilies, can irritate some people's guts, which go through the blood-brain barrier and create more neuroinflammation. I had a lady who was given a bag of kiwi fruit, gold kiwi fruit, beautiful. And she ate 7 or 8 of them in one day because she just loves them. The next day she could hardly move. She was so stiff and sore. And it's because she'd overwhelmed her system with fructose. And fructose, of course, is sugar. Sugar is quite inflammatory. Neuroinflammation occurs with too much sugar. So yeah, she learned to just have one next time. And another stressor is, as I've mentioned with the example of the shopping mall, being overwhelmed by too much information coming at you all at once. And a lot of you will have experienced this. You just feel like your system gets wired and you just want to get out of there. But sometimes you can't. Sometimes you just got to box on, and that's quite difficult. And saying no is difficult, isn't it? When you're overwhelmed. But I think when you realize that you are in that group of highly sensitive people, and that's an okay group to be in, you've got all those skills that comes with being a highly sensitive person, you kind of allow yourself to have the permission to not get overwhelmed, not go when it's maximum busy time to the shops, or not try and cram all the work in before bed so you can't actually calm down enough to sleep, because sleep is gold. If you're not getting your sleep, then you're still increasing inflammation by not bringing it back down. Sleep reduces neuroinflammation, and if you don't get sleep for 2 or 3 nights in a row, the neuroinflammation stays up. So yeah, that's becoming more recognized now as well. And of course, physical stresses. Some people insist on high impact exercise, not so much fibromyalgia because it can make you feel worse, but some people who are overstressing their system try and combat stress with exercise, but actually overstress the exercise levels as well. So it keeps things on the up in terms of sensitivity and overwhelm. So just moving on, how am I doing for time? 7 minutes till the next bit. Just to let you know that brain MRI studies have shown that there's a big overlap in the areas that are active during chronic stress and also in chronic pain. So if you've had persistent pain for a long time, the brain areas that are active in the stress areas of the brain are also active when you've got pain. So that they think there's a huge we know now there's a huge relationship between ongoing stress and chronic pain. So I'm not talking about, oh, I'm just about to do a big seminar in front of 200 people, so I'm a little bit stressed. I'm talking about short-term stress. I'm talking about ongoing, continuous stress where you can't get the switch off button to bring you back down to rest and digest. Things are at you all the time and you've got persistent stress. Could be a very difficult relationship, could be highly stressful work environment, it could be threats to your livelihood because you don't feel able to work at all at the moment, and that's continuously stressing you. Or it could be unknown nutritional stressors that are stressing you, or all of those stresses I mentioned before: emotional stresses, physical stresses, nutritional and sensory stresses. So these areas of the brain are active in stress and also in chronic pain, so that we know that there are links. So persistent stress, as I say, it's normal to have acute stress as long as you come back down, means that your autonomic nervous system, which is your fight or flight system, is constantly switched on in hyperarousal. So you have a much more easily triggered stress system where your fight or flight goes off. You feel wired much more easily than someone who's not in persistent stress. So you're primed for threat all the time. So your body is looking for potential threats. So your brain is rather. So your body becomes hypersensitive. Sight becomes, you're more light sensitive. You're letting more light in so that you can see visually if there's a threat coming. Your sound becomes much more sensitive, so you can hear the threat coming much more easily. Light touch, if something touches you, you're ready with awareness. So your senses become heightened and primed. And the body itself loses some of that, what we call proprioception. Proprioception is your awareness of body positioning. So you sometimes you just don't feel, you know where your body parts are very well. So I've got one lady, for example, when she gets highly anxious, she has fibromyalgia, she squeezes her thighs when she's walking along so that she can feel her legs properly. So she needs that sensory input. Sometimes wearing a firm belt around your hips can give you sensory input. Some of you may be aware of weighted blankets. A weighted blanket gives you some nice pressure around the body, which gives the brain some sensory input from the body where it's lacking, because it's so busy looking for threats in the environment with the other senses. So your brain becomes wired for threat all the time. And we know that when you have persistent stress, you have changes within your genes. Your telomeres are the little gene protectors at the end of each shoelace of DNA strands. And when those are diminished with persistent stress, then that leads to inflammatory disease and degeneration. So we know that persistent stress is not a good thing for the body, and it keeps everything very heightened and sensitive and sore. So just a couple of things from the latest conference on fibromyalgia from Europe. They are wondering quite seriously if it's actually part of the autoimmune disease family. So some researchers think that it is an autoimmune disease. However, they haven't found any autoimmune autoantibodies in fibro. There are lots of mixed study results. So some say yes, some say no. So that you always wonder what the truth is there. And also with fibromyalgia, it's not very often that there's a fever involved, which is an inflammatory response to get the system going. And it's also unresponsive to anti-inflammatory medications. So when I'm talking about this neuroinflammation, neuro means nerves, by the way, neuroinflammation within the brain and spinal cord, I'm talking about a very low grade immune response ready to fight threats. It's not inflammation like rheumatoid arthritis, where you can actually register that inflammation in a blood test. So fibromyalgia inflammation is so low grade that it doesn't come up on bloods, which can be quite frustrating for people. Apparently, you only get raised inflammation in the people who are more on the obese side of body weight. The ones that think it is autoimmune say that, yes, it is, because a virus starts it sometimes. So that means it could be autoimmune because your immune system's fighting the virus. All right, thanks. Getting on in time. And also, there are other factors with autoimmune diseases like genetic, hormones, environmental factors leading to hyperstimulation of the system, which is related to autoimmunes. And the other thing is people who have autoimmune responses to reject breast implants have the same symptoms as fibromyalgia. So one researcher is convinced that fibro must be autoimmune because they relate so closely. So there is a lot of interest I'm just going to whiz through these two, a lot of interest in the way that viruses and fatigue after viruses is the same as fibromyalgia. So there's a lot of overlap now in the research areas. I've mentioned gut, so I won't go into it again because I now need to talk to you a little bit about how to do rehab. So for rehab, we know that the main target for rehabilitation, first of all, is to bring down the neuroinflammation within the brain and spinal cord to reduce the pain and reduce the hypersensitivity. So that becomes the target, your brain and spinal cord. So the way to do that is to, first of all, empower yourself with a lot more understanding about what fibromyalgia is, what central nervous system changes are taking place. So bringing down the threat value, identifying your stressors, those sorts of things. So that's the first stage. The second stage is to start to retrain the body's awareness of its position, that word proprioception that I mentioned, trying to get the body much more aware of joint positions and muscles and what's actually happening in there, rather than it just being a lump of pain and stiffness, trying to refine that sensation. And then finally progressing on to the E word, exercise. I like to use the word movement, though, movement for well-being rather than exercise, because the word exercise scares people away completely, which I don't blame you. So the first thing we do is empower yourself with some pain science education. So really explaining that whole changes that are happening within your brain and spinal cord that are making everything hypersensitive, and that they're responding to potential threats and through stress. You know, if you're stressed, then your system is working out what's stressing me. What is it that's stressing me? What is the threat? So you talk about that and help the person understand it, and how neuroinflammation is increased with stress. And then retrain some self-awareness. So understanding that if you are a highly sensitive person, you've got to look after your system in a different way to someone who's a brick, who doesn't feel a thing, who can box on and get away with all sorts, but is actually causing harm in other ways, potentially. But if you're a highly sensitive person, you need looking after in a different way. And it's understanding that and being okay with that. The other thing is that people with a coping style called defensive high anxious means that people who are defensive don't want the rest of the world to know that they're in pain, and they're often in caring positions. And if they're defensive, they know that they're highly anxious and wired on the inside, but don't want the world to know, but have a tendency to interpret different body sensations as potentially threatening. So, oh, I've got a different pain in a different area, that could be another problem. So, start to get really seeking treatment from lots of different places and looking for diagnoses with lots of different scans and getting upset because nothing's coming of it. People with fibromyalgia do tend to have more of a defensive high anxious coping style. So that's good for me to know when I'm treating somebody, to know how best to work alongside that person with that coping style. Which I did my research on and know quite a bit about now, thankfully. So 4 things you have to observe to bring down the neuroinflammation: stress management, sleep management, food, movement. So stress, we identify the stressors, and we may need to have support from a psychologist at the same time. Rest and reassurance using breathing strategies, which I'm sure a lot of you are aware of. There's a reflex inhibition technique that I can show you called the Moro reflex, which I haven't got time to show you now, but it's quite useful for bringing down fight or flight. So that's a useful strategy. Knowing how to pace yourself, knowing when to stop and not push through that limited envelope of energy. If you've only got so much energy, you have to stay within that rather than trying to bash through the sides, because then you flare and then you don't have a very good few days after that. And also, of course, being a sensitive person, you're probably not one who wants to say no to people, because you might have people-pleasing tendencies. Being a sensitive person, you want to keep people happy. But saying no is quite hard to do, actually. So stress, sleep hygiene. I'm sure most of you know about sleep hygiene, so I won't dwell on it now. But basically, don't overstimulate your system at nighttime. Use more amber light and yellow lights, because that switches on your sleep hormone. So blue light, she says, using a blue tint on the screen here on the edges of the slides, my apologies, in the evening. I should have used yellow. But using amber light is sunset colours, which switches on your sleep hormone, melatonin. So try not to overstimulate your bright blue sky. Oh, it's daytime. Let's switch off the sleep hormone. Eye masks, of course, don't let light into the system at night if you can help it, because otherwise your melatonin switches back off. Earplugs, some people who have had trauma, especially nighttime trauma, will not put earplugs in. Therefore, ear filters might be better. So these little funny shaped things underneath the eye patch here are called calmer earplugs, or flare calmer earplugs. Calm as in staying calm, C-A-L-M. And they're filters, so you can still hear a little bit. So if you've got children, you need to make sure you can hear them. It reduces the sound of the snoring partner, but it doesn't take out the ability to hear an emergency with the babies, if that's what you need to be keeping an eye out for. And I was introduced to the Dodow sleep aid, which is on the left here, from Eden Sleep, which is in Bethlehem, where I work. And what it does is, at night time, if you can't get to sleep, it shines a cone onto the roof, and it just shrinks and expands the cone in your breathing rhythm, or in a rhythm that it suggests you should use for your breathing. So you do your breathing in that rhythm, and you just start to nod off. Low breathing is actually a clever way of telling your brain there is no threat, we can be calm here. And breathing is very powerful for that. So those are some sleep tips that you can use. The weighted blanket doesn't suit everybody, but it does suit a lot of people who like to feel that security and also that little bit of pressure from all around the body without poking into particular sore parts. Very, very effective. 10 to 15% of your body weight. So most average adults would be a 7 or a 9 kg. Make sure it's cotton with glass beads, not polyester with plastic beads, because you will overheat. Okay, 3 minutes to go. So I usually recommend either the FODMAP or the AIP, so autoimmune protocol diet, because the autoimmune protocol eliminates the known irritants on the gut for 3 weeks, and then you introduce one at a time to see whether that particular food group irritates your gut and makes you sore and stiff. So the autoimmune protocol, so autoimmunewellness.com.au, so an Australian one, autoimmune wellness, has that diet. And autoimmune, also, what's her name? Dr. Sarah Ballantyne. She designed it, actually. She's a researcher in America, and her website is thepaleomom, because she's American.com, thepaleomom.com. So basically, there have been some research studies to compare the different diets, and the main thing that they're pushing now is nutrient density. So as long as you're not eating just pasta because it's easy, or just rice because it's easy, have lots and lots of fruit, veg, not so much fruit because that's sugar, but lots of veg and a small portion of meat. Okay, moving is more about moving for well-being, so you don't stiffen up and get too sore, but also movement reduces neuroinflammation within the brain and spinal cord, which in turn reduces your pain. But you have to do it in a graded exposure way. So start with small amounts and gradually build up, and not intense, because too much exercise flares you, but too little exercise is also not good for you. So you need to be able to find that balance of some stretches and some gentle movement, like walking or something that you enjoy. It's very important to actually enjoy it as well, or at least not hate it. So think of it as movement for well-being, not exercise really, because that's a bit scary. Then we would retrain the body refinement, body awareness. So there are different ways to do that because the body becomes disconnected after trauma, which is what this slide says, but I'm going to skip quickly to what you would do. You would do it in a safe, everything that you do has to be safe, because if it's not safe, your brain goes up with its threat perception, says this is not safe, I'm going to alert you to this problem by amplifying the pain because of this threat. So it has to be within a safe environment. Even the person who's advising you on movement strategies and on the rehab has to be someone you trust, because otherwise that's not safe, and that amplifies the pain and the threat perception. So I would normally go through a process of helping you modify your senses. So some people like the weighted blankets and the pressure garments, others with fibro definitely don't. We can use light and sound modifiers to reduce that sensory overwhelm. And then we would do a little bit of postural awareness and control work just to restore a refined movement around your middle, which is usually what's lost. Proprioception, that word again. I can also help you to understand your senses a little bit more by retraining some of the sensory function in your body, which is lost with these problems. Oculomotor is eyeball control and how you process visual information. That can be useful. And sensory discrimination. So can you tell the difference between different sensations, or is it just all a blob of pain? And so retraining that ability to really perceive more accurately what's happening in the body so that the brain feels much safer, because the brain can't register what's going on. That's a threat to it. So it amplifies that pain again. And we would do perhaps some fine motor control exercises, but it's all about getting the sensitivity of your body perception restored a bit better. And finally, because I'm out of time, exercise has to be done in a graded exposure way. So it has to be, start slow, it starts safe, and then you gradually build up. And they reckon that stretches are just as valuable as doing some low grade exercise. So as we finish, just to let you know, I am based in Tauranga. If you would like to see me, then I'd be more than happy to help you. If you have an ACC claim with an injury, just ask your GP to refer me a letter saying specialist physiotherapy, and then it's fully funded by ACC, so you wouldn't have to pay. And otherwise, you'd be more than welcome to come privately as well. I'd love to be able to help you, and I can do it via telehealth if you need me to. Okay, that's it. Just about on time, I think.
Perfect timing. Thank you so much for that. I learned so much just then, and I'm sure everyone watching did too. We've got quite a lot of questions, so I'll just jump straight into them. Someone's asked, you pretty much covered this, but what things to avoid to get fibro flare, specifically diet?
Oh, okay. So I had a lady very recently with fibromyalgia who went onto the autoimmune protocol diet, and she cleared her symptoms right down to a 1 out of 10, from 6 to 7 out of 10. So diet can play quite a huge role in reducing neuroinflammation. So the things to avoid for the first 3 weeks are the nightshades, sugars, excess caffeine, because that overstimulates an already overstimulated system. Those would be the 3 really, and of course the old classic gluten and dairy for some people. So if gluten and dairy causes you bloating or runny tummy, that sort of thing, then you might want to try avoiding that for 3 weeks. So once you've healed your gut and you've got a steady dietary system going, then of course if you go to a friend's house and there's a party and you have a big sugary weekend, you're going to flare. But at least you'll know that it was because of the sugar which stopped you sleeping well, and you can pull it back in. You can take the sugar back out, monitor your sleep hygiene, and get back in control. Cool. Yes, so anything that causes a threat to the system as well is a way to avoid a flare.
And you said the gluten, some for some people, dairy for some people. That would be with, apart from sugar, that would be with most things. Everyone will react differently. So nightshades could be fine for some people.
Exactly. So what the autoimmune protocol recommends is that you take them out, all of them out, for 3 weeks. And then if you think, oh, I'm really craving the tomatoes, eat some tomatoes and then wait for the 3 days to see if you have a flare. And if you don't, or you don't have the bloating and that sort of thing, then tomatoes are probably okay for you. So that's quite nice. It's quite methodical.
Yeah. All right. So the next one we've got is, why does changes in weather make fibro worse?
That's such a good question. That is such a good question. And you can feel it now, can't you? Because it's going to rain. Well, if you're in the Bay of Plenty. Yes. So they think, they don't know, for starters, but they think that if there is low-grade inflammation in the system, particularly with joints, which they may or may not be with fibro, that's still controversial, then low pressure, low barometric pressure causes a slight expansion of the joints, which activates those stretch receptors. So you feel things, your joints are stiffer. But again, that assumes that there's some low-grade inflammation within the tissues, which is still a controversial matter with fibromyalgia. They can't decide whether there is or whether it's actually all central nervous system. Yeah.
And the next one, what is the best way to manage fibro according to your expertise for women?
Get your hormones sorted out, if we're going particularly for women. So if your estrogen is up and down, then that's well worth a visit to a hormone doctor. And also for women, often women are on the more highly sensitive spectrum of the healthy population. So healthy population, 15 to 20% of people are naturally highly sensitive, and a bit more of those will be female than male. So if you're in a caring position or in a job which involves, responsibilities, it's managing to say no, to boundarying yourself so that you're not overwhelming your system with too much to do, managing stress. The stress management is huge. Identify your stressors and have strategies to manage the stress. So breathing, meditation works for some people, prayer. Spiritual life is actually getting a lot more research attention too, because understanding who you are is quite an important aspect of reducing stress. It's interesting, especially in this very uncertain age with all sorts of changes going on, and people can be, any gender they like, for example. There's a lot of uncertainty around now, a lot more anxiety. So that's why people are talking more about spiritual life, because it gives them a grounding and a truth base, if you like, to work from. So for women, dietary, hormonal and stress management, understanding your sensitive system, stress management wise, I think would be probably my 3 top priorities.
Cool. And someone asked if you would include the links and suggestions, and I said that yes, these will all be in the recording, and perhaps I'll just get you to email me some links and we will include them in the description.
Sure. So do you mean the nutritional ones particularly?
Yeah, I'm not sure.
The websites, yeah, I think those are the websites I mentioned.
Yeah.
Cool. In fact, if you like, I could even put the way that people diagnose, the diagnostic criteria as well, if people want that, and the central sensitization inventory, which is the list of symptoms. Quite happily send those in.
That would be great, thanks. And then Melanie, she wanted to know the connection between pain and FND. She was told by the A&E doctors when her FND was triggered that her fibro made her more likely to get FND. She still suffers from both and would like to understand the connection.
Yeah. FND, Functional Neurological Disorder, is what the doctors will tell someone they've got if they develop a lot of, say, weakness or loss of feeling, say in the legs, after a trauma or when there's no apparent trauma. But the main thing is there's no apparent nerve damage to cause the weakness and the loss of sensation. So functional neurological disorder is very often related to trauma. So when the system gets into extreme fight or flight, one of the responses of the nervous system in extreme fight or flight is to shut down. So it's called dissociation. So the brain dissociates from the threat by just shutting down completely from it. So you lose function in the legs and you lose sensation in legs if it's the legs that the FND has affected. So I had a lady who had a truck crashed onto the left side of their car. She was a passenger, and within 24 hours she lost all feeling in her left leg, which is where the impact happened to happen. It didn't damage the leg, interestingly. She had some back pain, but the scan was clear. And she had functional neurological disorder by dissociating the whole trauma to the left leg, didn't want to have a bar of it. So that's another type of FND. So the link between that and fibro is the whole threat evaluation. When the brain thinks there's a threat, it's in fight or flight, and it can either shut down or go into hypersensitive pain and senses, depending on where it is on the spectrum of shutdown.
Oh, thank you. And Rosella asked specifically a question about Napier, but I think this almost applies everywhere. How do you find a doctor that will listen and diagnose fibromyalgia? She is sick of being fobbed off, and I read this all the time in our fibro support group online.
Oh, I hear you so much, because it's so frustrating. And being an educator, I know that we're trying to get the education, but GPs often don't have the knowledge of this unless they've studied it. So, as I say, what I'll do is I'll send the diagnostic criteria which GPs should use to diagnose you. So what you could do is fill it out and take it to the GP and say, well, look, actually, I do fulfill the criteria here for fibromyalgia. Can you run me some blood tests to make sure it's not an inflammatory disease? And can you run me some blood tests to make sure it's not an autoimmune disease? And if those are clear and you fulfill these criteria, then that would be fibromyalgia. It is frustrating. Yeah. So I hope that would help.
That would definitely help. It is very frustrating. And at Arthritis New Zealand, we're really hoping to create some fact sheets that people can take to their doctors around these really difficult to diagnose conditions. So yeah, that would help a lot.
Yeah, absolutely. And if you want to print out the bits of, like, I could send that slide as well, so
to
that
our
you
participants.
how to recognise the symptoms.
That'd be very helpful.
Yeah.
Alexandra asks, same symptoms as SEID, ME, CFS. So is it that or is it not? What's the difference?
Oh, good. These are great questions. So chronic fatigue syndrome is characterised. There's overlap. Start there. There's overlap between all of those. Chronic fatigue syndrome differs from fibro in that it was always started by a virus, whereas fibro is only sometimes. And post-exertional malaise is a big one. So some people with fibromyalgia can do exercise and feel a bit perked up for a short while, quite perked up, whereas someone with chronic fatigue syndrome specifically feels absolutely wiped out, even if they climb stairs. That's a difference between them. Often people with CFS have a persistent sore throat because the immune system's always on the go. So there are differences, but they are subtle. And they both have nociplastic pain in the center of them. What was the other one?
I just lost the question.
Oh, that's okay. But all of those three have
SEID and ME.
Yeah, so ME is a subset of chronic fatigue syndrome as well. Yeah, so all of the stuff I talked about today applies to those, but they have different characteristics. Just subtly, well, not subtly, there are different categories. So yeah, you still would need to use the same treatment strategies and understanding the heightened system. The other thing about chronic fatigue syndrome is the oxidative stress, which is where you can't metabolize your oxygen in your cells, which is why you get this constant collapse of energy, which doesn't happen remotely as much in fibromyalgia. Yeah.
Okay, we've just got 2 minutes, but I'll try and squeeze in one more question. Can fasting cause stress pains?
Yes. Yes, indeed. Yeah, fasting is a stress on the body, and it is like a popular thing at the moment. But it's actually quite stressful for the body that's expecting its nutrition to not have it, so it has to go into crisis mode almost, which it will cause some stress pain. The reason people are fasting is because they think it actually stimulates the immune system by stressing it. It's like having ice baths. It stresses the immune system because there's bits of research coming out to show that acute stresses trigger the immune system into doing something to resolve a situation. So it's very new, early research, not enough known about it yet. It's all theory. But that's why people are doing these things.
And we have another question that might be a simple yes or no. Is high heart rate associated with fibromyalgia?
Yes, it is. I'm afraid it is. Because high heart rate is a dysregulated or poorly regulated fight or flight system, where it's difficult to bring back down the fight or flight because your parasympathetic rest and digest system is struggling to function well. And that's what they call heart rate variability. So if you have poor heart rate variability, it means when it's up, it can't come back down again, can't be varied to back down. So yes, it is, I'm afraid. And that's one of those autonomic dysfunctions that I was talking about.
Okay, great. Well, I think that's all the time that we have tonight. Ngā mihi kia koe, Dr. Jacqui, thank you so much for coming on tonight, and ngā mihi kia koutou. Thank you everyone for joining us.
Thank you for inviting me, Tracy.